The way that VRpatients approaches artificial intelligence is we crawl, walk, run towards it. However, there's kind of a competing thing happening there, which is that it is like a snowball rolling down the hill. We can't sit and wait for AI to slow down and mellow out and then make our decisions to implement or test or try something. And so behind the scenes, we have been testing and doing research and development and even minor implementation beta tests and alpha tests to see what will actually move the needle for our customers. What will help improve competency? How can we utilize AI and keep things objectively gradable remotely? These are all really hard questions to answer because AI hallucinates and it likes to do its own thing. And is it secure? We gotta make sure everything is secure. So recently, VRpatients has implemented an alpha. And this is not natural language processing. This is large language model conversation.
Hi, my name is Devin. I'm going to be your nurse today. How are you feeling?
I'm not feeling great, Devin. The pain is really getting to me.
Well, you sound a little bit frustrated or irritated. Can you tell me more about that?
So suddenly, I can have a natural conversation without having to select dialogue. And the patient can respond to me. And we don't know what the patient's going to say, but that's okay. Because like reality, they're free to improvise within bumpers in the bowling lane. And that has really been the trick. How do we give these patients, these artificial intelligent patients, bumpers in the bowling lane to make sure they don't go off the rails too much? For example, we want the student to ask fundamental questions, assessment questions. They might ask about the patient's pain and when it all started. But if the patient starts to tell a story about their last vacation, it's actually incumbent upon the student to guide them back and say, actually, I want to know what you were doing the moment the pain started. And then we want the avatar to respond in kind, on point, on story, within the guardrails. That's actually a really good way to assess, is the student guiding the patient to the correct differential diagnosis, extracting out of them what they need to know so they can provide an appropriate treatment.
Okay, I understand that you're having a very difficult time. Allow me to give you some pain medication and we'll see if we can reduce your pain. Can you give me, how bad is your pain on a scale of 1 to 10?
It's a 7 out of 10, and it's really unbearable right now.
Don't worry, I'm going to take good care of you. I hear you.
One of our early successful attempts at this integration of AI is a very common patient that is seen across the country in clinics and hospitals and urgent cares. And this is a 24-year-old female with lower quadrant abdominal pain. So this patient comes in and it is up to the provider or the nurse to figure out what's going on. And it's such a phenomenal scenario because there's so much happening in the abdomen, and there's diffuse pain and there's referred pain, and so you really gotta nail down a differential diagnosis to get to what's the problem. In this simulation, the AI knows that the correct diagnosis is a kidney infection, a pyelonephritis or something like that. But the learner doesn't know that. That means that if we can engineer a prompt for this AI to operate within boundaries within the simulation, then the learner can ask innumerable questions. Tell me about your nausea, vomiting, diarrhea, are you pregnant? And the patient has not been preloaded with the answers to those questions. It just knows those aren't the correct, that's not what's wrong with me today. What is wrong with me today is the kidney infection. So I'm gonna say no to pregnancy. I'm gonna say no to diarrhea. I'm gonna say no to the question about, did I eat something different or out of the ordinary? And we don't actually have to give it that dialogue in advance.
Oh my goodness. Thank you. I can already feel that starting to work. I didn't think the pain would ever stop.
Good. I'm very glad that you're feeling better.
So, now that I'm not thinking about excruciating pain in my lower back, what's new in nursing?
So how do we grade this type of thing objectively? The first thing we need to do is give the AI a rubric that we want it to always operate within the boundaries of. So for this simulation, we chose a grading rubric for assessing a patient encounter and dialogue. And what's wonderful is that we can train the AI to take what was said by the user, what was said by the AI, what was asked of them, the treatments that were given, that were done to them, and then provide an output, almost like a script of here's what happened. That includes key moments, why you scored an excellent with your empathy to the patient, because you said this and the patient said that. Why you might have scored fair with your detail-oriented questioning, because you didn't ask about your next most recent menstrual cycle or were they sexually active with abdominal pain to make sure that you can find out if they're pregnant in lieu of a pregnancy test, or maybe it's a loose IUD. Like, there's so many things it could be. And so by being able to operate within these boundaries, we can actually successfully provide AI in an objectively gradable way. So at the end of the simulation, the clinical educator can sit down and see a debriefing output and then have a conversation with the student about, so I see here your strengths were here. You had strengths in these 5 categories. And here's why, because you said this and the avatar said this, or you did this and the avatar did that.
Communication. The provider communicated effectively, introducing themselves, acknowledging the frustration. Empathy was shown, especially when the patient went into an emotional state. However, there was a limited active listening. Okay. As the provider could have engaged more by paraphrasing or summarizing the patient's concerns. Okay, that's good.
Where you can improve are these 5 categories, because you said this and you really should have said something more like this, or we should have guided them more empathetically.
So I maintained patient safety by ensuring the patient's comfortable, addressing immediate pain, no mention of confirming the identity. Oh man, discussing potential next steps. Yep, let's do it again.
Then the clinical educator can have that debriefing moment that is contextually with what was actually said and how the patient responded. This is how we can provide some form of objectivity in an asynchronous platform that is distributed across innumerable students through simulations that are embedded with artificial intelligence, yet remain editable by the end user. Create any simulation with any physiologic response and allow that patient to operate within those bumpers in the bowling lane and respond in kind, remotely. That's how VRpatients approaches artificial intelligence.